My name is Debbie Lester, and I am representing the 10 area agencies on aging in the great state of Montana. And we are so proud to be here with our brothers and sisters in the disability community. Our role is to promote independence, dignity, and the health of older adults and those that care through them, through advocacy, education, services, and volunteer opportunities. And those volunteer opportunities are a very important part of our services. Our primary role is to provide supportive services. Those are preventive services. And what are we trying to prevent? We're trying to prevent more costly and expensive and less desirable services without these preventive programs. Continued state funding is imperative in order to keep community-based services for Montana's seniors whole. Our request of you today is to find a way to keep funding our programs and to reinstate the $1.5 million per year that seniors will be losing. What does that mean? Well, for us in Missoula, it means that our meal delivery programs will be cut by a third. We deliver 82,000 meals in Missoula County, and we'll be cutting that number by a third. What are preventive services that help keep people independent? Transportation is being one of them. When seniors stop driving, they're out of sight and out of mind. They're invisible, and many of you know what it's like to be invisible in the community. So we provide transportation, Meals on Wheels, personal care. You just heard Travis talk about personal care services and how important they are. Bathing, dressing, eating. We provide homemaker services and case management, and we provide respite services so caregivers, husbands and wives, caring for their loved ones can have a break so they can continue the valuable work that they do. And we provide education for Medicare and Medicaid long-term services. We provide ombudsman services so we can protect that residents living in nursing homes are protected, that their rights are always upheld. And many of us are sponsors of the Senior Corps services, and those are the volunteers that help keep seniors independent, living in their homes, where they want to be. The demographic shift in our state, there is no doubt about it. The seniors are coming. And if we're all lucky, we will all get there. In 2025, Montana will have the 5th highest per capita population in the United States of people over 65. The people over 85 are the fastest growing segment of our population, and their need for in-home services is more and more important every day. Much of it is not medically related, just the small, simple services that help us keep independent. We ask for you to continue to restore this $1.5 million to senior services. The alternative is very, very costly. I just want to say that unfortunately we're facing these cuts at the federal and the state level. We cannot continue to support our seniors in the manner that they can live in dignity. The Office of Management and Budget has determined that the Administration on Aging programs delivered through the area agencies on aging are one of the most cost-effective and efficient programs in the nation. These programs are proven to work, and we hope that you continue to support them. Now I'd like to bring up Claudia Clifford from AARP.
Thank you, and I want to thank the Independent Living Centers for organizing today's event. This is an important point in the session when the legislature is going to really start putting the wheels to the ground and figure out where our budget's going and what we're going to afford. But I'm going to start off saying that there's been good news this session. Did anybody miss the good news? I think some people in this Capitol missed the good news, which is that our economy is doing better. The legislative staff has even told the legislature that they can anticipate another $97 million in revenue over the next 2 years. So the tragedy this session, to me at least, is that all these cuts that we're here today talking about really aren't necessary. This isn't about tough times and needing to make tough decisions. We could be funding what we need funded here to address the needs of those people who are so dependent on human services. So that's a message I want to encourage you to take out to the legislators that you're talking to during today and for the course of the session is they need to revise their revenue estimates and start to address in a realistic way what are the human service needs in this session. So for seniors, and obviously ARP does a lot of advocacy for seniors and for persons with disabilities. You've heard a little bit about some of those cuts. We're big advocates for trying to provide more funding for the area agencies on aging. Very important services that you just heard about. Obviously, we're very, very concerned about Big Sky RX. This is a program that was put into place by voters. They increased the tobacco tax in 2004. They designated that tax for assistance for folks to be able to afford prescription drugs. It helps both seniors and persons with disabilities that are on Medicare. This is not a program that is general fund dollars. This is a program that has its own special revenue that's been designated to and funded for a number of years now. So we're perplexed by why this program has been slated to either be cut or eliminated. At this point, we do have funding for about 1/3 of the people on Big Sky RX, and we're hoping to convince the legislature during the course of the rest of the session how necessary this program is for those people that need the assistance in being able to afford prescription drugs. I want to touch a little bit on home and community-based services. We're major advocates for those services because although we support nursing homes, most people don't want to end up going to the nursing homes. And we need to expand and continue to support the development of home and community-based services. We have seen some progress this session. Legislators have recognized the importance of those services and they've restored some funding for home and community-based services themselves. But one thing they haven't done is to support the workers who provide those services. Previous sessions, we've seen an extra wage bonus or increase for those workers that work in your homes and communities and in the nursing homes, and we'd like to convince the legislature that helping those workers stay in those jobs so there's not the high turnover, so that you get consistent service by the workers that provide home care for you. And lastly, we're very concerned about the funding for LEAP. Those are federal dollars. Those are just basic dollars that help people with home care, home heating costs and weatherization costs. So I'm not going to use up much more time today, but thank you for your involvement in advocating for human services, very crucial. I'm going to introduce one of our key volunteers, Del Longquist, who has some first-hand experience with Big Sky RX.
Passed a great program called Big Sky RX. Now, AARP had me on the road during that period. During 2005, 6, and 7, they sent me to over 100 senior centers around Montana with step counters and resistance bands. AARP wanted to get those old folks moving and get them to exercise so they wouldn't need what? Prescription drugs. But at every session that I went to, everywhere I talked to senior centers, people would say, Dale, you're from AARP, do you know anything about Medicare Part D? And then I'd explain Medicare Part D, and the response always came back, but I can't afford another insurance premium. I can't pay more money for insurance. And then I would tell them about Big Sky RX. It was like a weight lifted from their shoulders. They could have prescription drugs. They could take that prescription out of the kitchen drawer and take it to the drugstore and have a prescription filled, because now they had Big Sky RX. Now I have to tell you folks, I'm a Republican and I'm proud of it. I voted for Goldwater in '64 because he was a great conservative leader. And today, the Montana legislature has many great conservative leaders. And they need to get behind Doug Roberts and support